Hello, so this is Ariana Cook and I'm going to be performing catheter care on today. It's a female resident and this is the state skills test for catheter care. So first, when you come in, you want to greet your resident. Hi, ma'am. My name is Ariana. I'm your CNA. I'll be performing catheter care for you. And then you're going to wash your hands, and I'll turn around and do hand hygiene real quick. And then you're going to close the curtain for privacy. First, what you want to do is have a basin, and then you're going to fill it around 2/3, which is right here, for water. And then I would fill it with water. And then you're going to set that aside on the bedside table. And you're going to raise your side rails. So my side rail for here. And you would do it on both sides. Raise both side rails. Raise them. Raise the entire bed on which side you're going to be working on to good body mechanics, which is around right here or waist level. And then you're going to lower the side rail that you're going to be working on. When you do that, you're going to put on gloves. I have a box of gloves right here. And sometimes they're up on the wall, but today they're not. Sorry. Alrighty, I have gloves on. At this point, you want to keep the resident covered, but for the purpose of this video, I'm going to leave the cover. I'm going to move the cover down so you're able to see what I'm doing. And I hope you are. So you're going to take a waterproof pad. And then you're going to roll the resident over. So I'll spread out the pad for them. And this is a fairly large one. And then you're going to roll the resident over on their side. And you'll get the pads secured under them. And also roll them towards you. Alright, so then you have the pad secured, and that's going to be under their butt. So I have my catheter, and then I'm going to cover them back up. Alright, and then you're going to get your bath blanket. And then you're just going to lay that under them. And this is to provide for privacy for the quality of life. And you don't want to shake it. because that would spread germs. Alright, and then from there, what you're going to do is move the primary blanket down. Alrighty. After doing so, you're going to expose the perineal area. So I have my perineal area. I hope you're able to see. Okay. So I have my perineal area. And then from there, you want to have your kidney basin. And then you just want to make sure that you have a washcloth. And you're going to, for the female, you would separate the perineal area. So separate the labia for a female. For an uncircumcised male, you would pull the foreskin back. And then for a regular circumcised male, you would just observe and make sure that they don't have any crusting, discharge, rash, irritation, or anything. Anything that would be cause of concern that you have to report to your nurse. And so then, as far as caring for an uncircumcised male, you pull the foreskin, grab a washcloth and soap, and you will clean circular. Today I actually have a female patient, so if I saw any redness, itching, crusting, rash, you would separate the labia and then clean down from the urethra to the anus. But perineal care is tested on a different scale. So then after that, you're going to have your kidney basin. Your washcloth. And soap. So from there, what you're going to do is have your washcloth in your kidney basin. And you're going to dip it in there with water. Wring it out. And then you would soap it up. I think it actually does have water. Alright. So now that it is soaked up, make a mitt. And then during your catheter care, make sure that the tubing is very close to the bed. And so I have some right here. So you have your catheter, soap, water, soapy rag. And from there you're going to clean where the catheter is next to the urethra. And then, so you clean around there. When you do clean, you do it around the clitoris, urethra. And then from there you wet your rag. And you would get a different rag. And this will go on like soiled linen. with a different rag, dump in your kidney basin, and then get your soap and soap it up. And then you clean from the point of the meatus and urethra, and then you clean down about 4 inches. So I'll hold it up. So clean down, and then get a new spot, down, get a new, different spot on the rag, clean down, and then one more time, and clean down. And then you would do that until your catheter is clean. So also, then once you do that, this rag will go in soiled linens. And then, sorry, okay, side my rags. And then you would rinse. So this will go from here, rinse it out, and then you would do the same thing. So from the point of the urethra and the catheter and the meatus, you clean down, get a new spot, and this is to rinse it. So you do that again, get a new spot, and go swipe down, and then get a different spot and go down about 4 inches. And then this will go in soiled linen as well. And then from there, you want to get like a towel and pat dry. Towel, and then you pat dry. And then make sure that the catheter is coiled and not moving. Pat dry. Alright, and then you would discard of this. Alrighty. So with there, you want to make sure that the catheter is secured to the bed during all of this. And it is, most of the time it'll have a clip like so. And then you're going to cover the resin again. Alrighty. Then you're going to, sorry. At this point, you're going to remove the waterproof pad. So I'll remove it and then roll the inside of the pad away from you. So in this motion. And roll your resident. Roll them back towards you. Alrighty. And put them back in the supine position. And you would discard of this as well. Alrighty. So, and then you're going to cover them back up. After, so you will take off your gloves. That was alright. So then you cover up your resident, cover them back up with their primary blanket. She lives in a private home, so she got to choose her blanket. And then you will remove the bath blanket. And then we would discard of this into the dirty linen. Alrighty. And then we make sure that they're comfortable. So pillow, fluffed, positioned correctly. And then once again, make sure that the catheter, and I'm going to uncover this so that you can see where the catheter is. So the catheter is right here where this white line is. And you make sure it's secured, coiled up to the bed, and then also clipped to the sheets as well. Alright, then you will perform hand hygiene, and then grab your bed rail that's been lowered. You're going to raise this bed rail, and then you're going to lower the bed back down to the lowest setting, and then you would lower this bed rail and lower the other bed rail as well, and then report and record. Thank you. Oh, and then also you grab their call light and place it into their hands close to them. Thank you.